that study is a fair assessment of the
I think it's fairly, I mean, I haven't read it in detail, but it seemed to me when I looked at it, it was a fairly good description of a sort of way to rank, dangerous drugs. And the reason it got headlines was because cocaine was listed as a less, not a less dangerous drug, but a less, had less of a danger to society comparatively to alcohol and marijuana. Because it wasn't used as frequently. It's still got a fairly good safety, acute ingestion safety profile as well. You can overdose on cocaine, but you do need to take it off. So that was a very interesting study combining this with a lot of social parameters.
Where do they, I was going to say about the study itself, where is it taken just in public?
This is taken from lots of different sources and synthesized together.
All right. And what about nicotine?
Yeah, nicotine is not here. Actually, nicotine would be way down here. If you've ever ingested any nicotine, or if you ingested a little bit of chewing tobacco, you usually immediately start vomiting. The amount of nicotine, if a child got a hold of a cigarette and ate it, it might be enough nicotine in there to cause very serious harm or death, because actually it's not meant to be taken that way. You don't get that much into your system when you combust it and inhale it, so it would be down a lot lower.
Yeah, if you take nicotine and inject it directly into your bloodstream, it kills you in 90 seconds.
Yeah.
That's probably higher, faster than any other drugs.
It could be at the right dose, for sure.
What is like alcohol? You just like take it as a mist type of liquid fuel?
It would be similar. I don't know if it would be that different. We'll talk about, I think when we talk about cocaine and methamphetamine, we'll talk about how the way you get the drug into the body can really affect how addictive it is and things like that. Basically, faster you can get a drug into the body in high amounts, the more addictive it is. That's why heroin, when you inject heroin directly into the bloodstream, and a lot of it, you can get an extremely fast, intense effect. Whereas when you take methadone orally, in a tablet, you get a very, very slow rise in the methadone level and a very, very slow decrease in the methadone level. And that's why they use it as a replacement there.
So smoking nicotine, right? That has the same effect as it's a psychological effect where it says that you need more, and every day when you wake up you need a cigarette. And then when they go to try to quit smoking, you can't quit smoking. Most people try to fight nicotine with nicotine. They give you a patch or they give you a pill. But really, you're actually not really fighting nicotine, you're feeding nicotine with other nicotine.
Yeah, so the idea of nicotine replacement therapies is that you're avoiding inhaling of all those other nasty things into your lungs by applying it through the skin or absorbing it through the mouth, in the case of the gum. And then you can sort of try to titrate the dose down. There's all sorts of things. There's a whole other sort of direction we could go, and that's really talking about why people choose to become addicted to anything, and what properties an addictive substance has. There's basically the simple answer is all addictive activities have some sort of rewarding property. If it didn't have a rewarding property, you wouldn't do it. So it usually feels good, and it usually causes a release of dopamine in a specific area of the brain called the nucleus accumbens. And that could be true for nicotine, or it is true for nicotine, or cocaine, or alcohol. It's also true for playing video games and beating some level that you haven't beaten before, or gambling, or having sex. So there's all sorts of things that are rewarding that a lot of people do every day. A lot of people try cocaine every day. A lot of people try all sorts of things every day. And some people want to try it again immediately, and some people don't. So there's a huge field of studying the neurobiology of addiction. And one of the latest trends, and there was a speaker around in the region in 2008 called Gabriel Maté from Vancouver who wrote a book, I forget the title of it, but it's basically about how his theory is that whether or not you're going to become addicted to substances as an adult happens in the first 36 months of your life. And it's a very early childhood education, or early childhood trauma of some sort that is going to manifest itself later as using some substance or some activity for rewarding properties because you're not able to cope, or you have some sort of thing that you're not getting. So it's a very interesting theory. And we'll talk, hopefully at the end, if anyone wants to stick around, we'll talk about a little bit about integrated drug strategy. I wanted to go on and talk about how we just define addiction, tolerance, dependence, drug use, and drug abuse, because it's very, it's not a very easy thing to do, especially if you want to do it in a very scientific way. So if you, I did this a couple years ago. I did drug abuse. What is drug abuse? I just Googled it. So this is the use of illegal drugs, or the inappropriate use of illegal drugs, repeated use to produce pleasure, to alleviate stress, or to alter or avoid reality, or all three. So right off the bat, this is from the U.S. drug site. So right off the bat, when you think about drug abuse, then I'm in, because I drink alcohol to produce pleasure, and so do a large number of people. It's an enjoyable thing to do, and to alleviate stress most times.
Smoking cigarettes too.
Smoking cigarettes would be on this. Right off the bat, we have this word, illegal. So who decided drugs were illegal? Who decided this drug was illegal? Normally, usually if you look back into the history of making drugs legal and illegal, it wasn't necessarily based on the most rational scientific grounds. Or the inappropriate use of legal drugs. Well, doctors do this all the time. They do off-label prescribing. And that's how they find how this drug that they were used to use for lower cholesterol is really good to prevent diabetes. So physicians do that all the time. Here's another one. Same idea, that for the use that it isn't normally prescribed or recommended, so physicians and other health practitioners do this all the time. Habitual misuse of a chemical substance. And then this brings in an economic factor into the term drug abuse. If you have any sort of economy or any sort of sale or transaction involved with the drug use, then that's drug abuse. And so drug abuse is a term that's really coming out of favor. And I'll actually come back to that slide in a second. One of the sort of Bible of psychiatry is the Diagnostic and Statistic Manual, and they're currently using the 4th edition. And this is what they have now: progression of acute drug use to drug-seeking behavior, increased chance of relapse, less responsive to non-drug rewards, and all of that is fairly accurate. Preoccupation or anticipation of drug use, binging, negative effects. So that's what they're using now, but there are still some problems, and there's going to be a new edition of the DSM that's going to come out, I believe, this year. And they're going to really try to get away from the terms dependence and abuse. Because you can become dependent, you could describe dependence, you could describe dependent drug users as not being necessarily drug abusers. So if you have chronic cancer pain, you're going to take a lot of opioids. You're going to become dependent on them, but you wouldn't necessarily be thought of as a drug abuser. And they're going to take the word abuse, I think, and try to limit it. And I think their new sort of favorite word is going to be use disorder. So they're also going to remove references to law enforcement and sort of get that legal, illegal thing out of the way. And so one of the things that you might see is someone has an alcohol use disorder as the sort of newer, a little bit more accurate term to describe the misuse of substances. A couple definitions. Tolerance, that just means you need more of a drug to get the same effect. So if I take 10 milligrams of morphine for chronic back pain for a few weeks, then I might need to take 15 after that, because the body, as we talked about, is in this system, it's trying to keep everything normal. One of the things that's going to happen when you take morphine is that your opioid receptors, which are morphine's target, are going to downregulate, and you'll need more and more of the drug to get the same effect. Dependence means the continued use of the substance to avoid adverse effects of withdrawal. And this is why they're going to try to limit the use of dependence, presumably in the DSM-5, because dependence is often thought of as being addicted, and there are different things. So most addicted individuals are dependent, but there's other people that are dependent on drugs that aren't necessarily addicted to the drug. And then withdrawal, usually, this is a fairly straightforward definition, actually, that an unpleasant or defined set of effects that you experience after stopping the drug. Okay.
What is the DSM?
Oh, the Diagnostic and Statistical Manual. It's basically this book describing all mental illnesses. And it's a way to try, it's a whole other lecture as well, it's a way to try to describe and categorize different mental illnesses. And so there's a lot of addiction, a lot to do with addiction in that publication. And it's got a lot of weight, it carries a lot of heft to it.
The one thing that said on the last one, or the second,
This one?
the next one, it says, no, the next one, sorry, with that, sorry, it says that
Look at this guy.
oh, right there, yeah, the causes of addiction remain unknown, but yet later it says the study was that your addiction became 36 months within your younger. So isn't that?
Well, I would say that that's a theory, but we still don't know. We still don't know the why. Like, so what is it in the brain? You can look in and go, that person. If I give that person cocaine, they'll probably become addicted to it. And if I give that person some cocaine, they might not. Even though they both might enjoy it in the same way. So those kind of mechanisms are, and what makes someone 6 years after being an alcoholic and six years later they'll be in a situation where they crave alcohol. So what has changed in their brain that's basically been a permanent change that is going to be with them presumably for the rest of their lives in some form or another. So that's what I mean about the specific causes of it.
And then there's some people that remain off of the addiction they were on for 4 years for the rest of their life.
Yeah.
Without ever returning back.
Exactly. So what's the difference between those people and people who relapse? What is it about? I mean, we know a little bit about relapse. So if you put yourself in the same situations, the same rooms with the same people that you were in when you were using, then a lot of those environmental cues will increase your risk of relapse. So we know a little bit about it, but we don't really understand it. So I've been going on for a while now. I don't have that many more slides. I'll just talk about a little bit about a few specific examples, and then we'll sort of finish up with a kind of open discussion for anyone that wants to stick around. Let's just talk about narcotics, and I'll start off by saying we shouldn't call them narcotics. So they're derived from the opium poppy seed residue. They've been used for 5,000 years, or probably a lot longer. So narcotics means to induce stupor, but in the 70s and 80s, it really got mixed up with as being used to describe illegal drugs. So cocaine doesn't induce stupor, it does the opposite. So it's really not a narcotic. So we now try to stay away from the term narcotic and talk about opioids or opiates. You'll see those interchanged. The opioid system is very interesting. We've got 3, and actually probably now 4 receptors in the brain that are activated by opioids like morphine. But we have 20 different peptides that we've identified so far, at least, that will activate these receptors. So these receptors are important for controlling pain in the body and causing pleasure and euphoric feelings just without taking drugs exogenously. But when we take drugs exogenously, we get we really ramp up that system and we feel really good. So what do opioids cause? Well, you take them because they cause a very pleasurable, euphoric, foggy, sort of floating, relaxed, sedated